Hi, welcome to the Fit and Healthy Today show. And today our topic matter is chronic pain. This is going to be part of a 3 to 4 part series on pain as far as defining it, the causes, and what you can do to get rid of it. My job is to teach you how to diagnose what's causing your chronic pain and then to get rid of it. Sometimes the best way to do things is to help self-diagnose, figure out what's going on, utilize your doctor for diagnostic purposes, and then do the best you can to get rid of pain. The medical arena has not done a good job with pain. They throw narcotics and wonderful painkillers that are addictive and problematic that do nothing to get rid of pain, and as a matter of fact, long-term usage can raise your pain to where you feel like you can never get off the drugs. I'm going to go through definitions of pain so you understand why pain occurs, and then address, other than trauma, the causes that, or things that can cause pain. Pain simply means inflammation, or inflammation means a reaction to or a rejection to something. So whether it be an injury, an infection, whatever it is, viruses, bacteria attacking the joints, as in the case of rheumatoid arthritis, that's the definition, truly, what pain is. Now, to get to what really causes pain, I'm going to get a little technical here without the technical terms. And so when we look at that, when an injury or an infection or a reaction to a chemical or food occurs, inflammation uses enzymes to penetrate the area that's the problem, okay? These enzymes dissolve the debris from the injury, and then your white blood cells come along and they kind of eat it all up and carry it away. It's this eating up process and the carrying away of all this debris that causes pain. That's oftentimes, for example, when you break your arm or you have something traumatic initially happen, you don't feel pain right away. It's because the body hasn't gone into its cleanup process of repairing, getting the debris gone, so the body can fix itself. That's the biggest reason why we don't feel pain right away. So understanding the process of, it's our body's healing process, trying to get rid of all the debris, all the stuff that was part of the injury or infection, is paramount to understanding how to control pain. Now obviously pain, besides facilitating healing, also is a warning to the body to stop moving the area or whatever it is. If you've got chronic knee pain, you've got an injury, a broken arm, it needs to be immobilized. It needs to be to where your body actually can go through this pain process. So those people are out there with chronic knee conditions that never rest them or give them an opportunity for the body to take action. That's a problematic, and you're going to have chronic pain as long as you have chronic inflammation. So it disappears when the antigen antibodies drop from the target area in question. That's the complexity of it all. So basically, if you got inflammation, you're going to have pain. When we look at causes besides trauma, you break your arm, you fall, you cut yourself with a knife, those are all trauma types of wounds. I'm going to be talking about the causes that cause pain other than those trauma types of wounds. Nutrient deficiencies, okay, and I can give you tons and tons of examples of all the minerals and all the nutrients that we no longer have in our diet. Probably one of the biggest one is going to be magnesium. They estimate that only in the standard American diet, you only get about 40% of magnesium from your diet. Now, when you're magnesium deficient, your muscles can't relax. Magnesium aids and abets over 300 different enzyme functions, and other minerals have the same types of things happening. So when you're eating the junk food diet, or you're eating the standard American diet where you're going to the grocery store and you're eating lots of fruits and vegetables, but they're mineral deficient, good luck. Our farming practices are not the same as they were 75 or 100 years ago, where we had nutrient-rich soils. It's changed. So nutrient deficiencies are probably one of the biggest problems that we have here in the United States of America. Good multivitamins. We're going to go into some of the other things that can help resolve these issues. Right now, I just want you to understand what potentially could be causing this chronic pain. Pain should only be temporary. Sensitivity to nightshade vegetables. And sometimes leave it up to the scientists rather than physicians to get us the research necessary to figure out why certain things happen. In this particular case, it was a horticulturist by the name of Dr. Childers out of Rutgers University. And horticulturists, obviously are plant specialists. And what he was noticing is that when mammals, particularly cows and goats, ate nightshade vegetables, they would get very swift moving, quick, besides potentially killing them, inflammatory, immediate, where they would be completely immobilized. And so he kind of got to thinking about this. So there was some major studies done by him and other universities that basically determined that between 74 and 90% of Americans are nightshade sensitive, nightshade vegetable sensitive. And that includes potatoes, tomatoes, tomatillos, peppers, certain spices like chili, curry, paprika. Those are all nightshade vegetables. And what they discovered, and this is paramount, if you have chronic pain, particularly anything having to do with autoimmune pain, fibromyalgia, arthritis, get rid of nightshade vegetables. And according to their data, when they got the nightshade vegetables out of their diet, 3/4 of the patients no longer had any chronic pain. 3/4 of them. So, getting rid of these, paramount. If you have chronic pain, experiment around. This is something your doctor can't do for you. Find out whether you're sensitive to nightshade veggies just by eliminating them out of your diet. Organophosphate, pesticides, they kind of duplicate. What they do, they have something called glucoalkaloids that interfere with the function of enzymes that make nerves and muscles function properly. So when you block these enzymes, your nerves and muscles, they can't function properly. Get rid of nightshade vegetables, organophosphates, in addition to other pesticide chemicals that use other minerals to block the absorption of your actual minerals themselves. Remember, as I mentioned, like magnesium, all these other minerals are necessary for nerve and muscle function. And when you have these other chemicals blocking the function of your minerals, and that's provided you're getting enough minerals to begin with, you're going to have, it can be sudden onset pain. I mean just debilitating pain. Or it can be very gradual by nature throughout the years of, hey, I never had a problem before, how come in my 40s am I having all this chronic pain? Literally, it just gets so much so that it suppresses these enzymes that the nerves and muscles don't move or react properly. Food allergies. Food allergies will cause chronic inflammation. Remember what I said about inflammation? Inflammation equals pain. Find out what your food allergies are. There are blood tests out there, that 99 panel types of tests that can test you for the most common foods. The 99 panel is for the 99 most common foods that you can have your doctor order, or you can order these test kits online. They're kind of expensive. Take it into your doctor and have you sent down to the lab if you don't have insurance. One of the most important tests that I ever got was getting that allergy test, because I had at one point chronic algebra, chronic joint pain, and I have to tell you that resolved, when I follow it, which I don't always do, that resolved a lot of it, a lot of my issues with inflammatory. Trans fatty acids, okay, they literally damage the cellular membranes around your cells. Okay, so when you damage the membranes around your cells, guess what? They don't communicate with each other. So you're going to have chronic nerve pain, chronic muscle spasms, all of that. Trans fats, in and of their nature, are inflammatory inducing. Inflammation equals pain. Get the trans fats, the French fry diet, all those types of fried, types of heavy foods, get rid of them. You're going to want to use more of your olive oils, your coconut oil-based types of products. If you're going to fry, which I don't recommend because it changes the molecular structure of the oils themselves, if you're going to fry, use those other alternative oils. Avoid trans fatty acids. And you're going to have to look for hydrogenated fats, things like that you'll find in your crackers, shortening, all those types of baked goods. They sneak it in because it's cheap. Okay? Leaky gut syndrome and candida. Most candida is caused by, and this is the yeast issues that a lot of people have in leaky gut. What that literally means with leaky gut syndrome is your body, your intestinal mucosa lining, it gets holes in it. Okay? So what happens is normally your food and your toxins, they get delivered to the intestinal tract, the food gets digested, and the toxins get eliminated. Well, when you have leaky gut, guess what? It leaks through the holes in the digestive tract. Okay? One of the major contributors to this is the lack of good bacteria in the bowel, those little good probiotic types of critters. The things that destroy that are antibiotics, drugs like diflucan, nystatin types of drugs, and NSAIDs. Okay? Those are your aspirin a day that the doc wants you to take to prevent stroke, that never prevented or actually raised the risk of stroke in senior women. The use of Celebrex, Vioxx, all those destroy connective tissue membranes. And guess what is connective tissue membranes? Your intestinal tract. So if you're taking NSAIDs on a continual basis, it's not if, it's when you're going to develop some of this leaky gut. Acid reflux drugs, too, block all absorption or most of the absorption of your minerals. Your body requires stomach acid secretion in order to break down minerals. Remember I told you without minerals, you're going to have chronic inflammation and pain. So as you take these drugs or decide to take these drugs, remember they come with side effects. And one of it can be, here you're taking Vioxx to reduce inflammation. One of it can be, boom, chronic pain. So maybe a short-term duration, but any long-term usage of these drugs, you're going to end up with leaky gut, chronic pain, inability to absorb nutrients, fibromyalgia, autoimmune disorders, because when you have these toxins leaking into your blood, they wreak havoc on all your tissues. They oxidize it, they damage it. They make you more chemically sensitive. They don't allow the body to detox. So, realizing this, take a peek at this, hoping you can take some notes at home. I'm hoping I can eventually get this on a website so that you'll be able to copy these down. We have these available at our vitamin and herb stores if you need copies of these so that you can help yourself. Plastics. I wrote the fancy name down here. You have chemicals found in plastics, and obviously those bind to your minerals. They are toxic by nature in and of themselves, which prevent the nervous system from properly functioning. Cadmium, sewage, air pollution, cigarette smoke. Cadmium found in so many different chemicals, pesticides in particular. The body doesn't know how to dispose of it. Can't get rid of it. So it builds up kind of like asbestos in the body. You can't dispose of it. It builds up, and there you go. It damages the kidneys, and it blocks the ability of the body to use its calcium. Remember, calcium neutralizes pH. It alkalizes the blood. It takes away the acidity out of the joints. Cadmium blocks that alkalizing effect of the calcium. Heavy metals. A lot of these heavy metals are in the same periodic section table, and what they'll do is they'll go into the body, the nervous system, other places where you'll require iodine or magnesium, and these heavy metals will build up and they'll prevent the body from being able to utilize its minerals necessary to reduce inflammation and help keep healthy tissues. Particularly with nerve pain, we find heavy metal exposure substantially with nerve pain. And so getting rid of heavy metals, you can get tested for that with hair analysis, is paramount. I want to briefly touch upon the diet. We're going to go more into this when I talk about detoxifying, but the major points in diet that we deal with when we have chronic pain, obviously, is to get rid of the nightshade vegetables. Gone, history, I don't care how much your family enjoys them. If you have chronic pain, get them gone. An alkali, organic diet, a modified macrobiotic diet. And when I say modified, I'm not talking about the standard American vegetarian diet of pasta and a few vegetables on the side. We're talking about very enzyme-rich raw foods. So I know of some physicians that like to use a macrobiotic diet, but don't in turn make sure that there's adequate amounts of proteins. So your beans, your lentils. There are rice protein shakes out there. There are hemp protein shakes. There are if you're into milk, which oftentimes a macrobiotic diet doesn't allow, there are alternative sources of protein to keep your protein levels up so tissue repair can take place. Detoxing, we're going to have a whole section on that as well. But basically what it does when you detox and fast is it forces those antibodies out of the joints and out of the cartilage. It flushes them out. So juice fasting, water fasting in that regard, it flushes these things that have been sitting there for years. Drinking a lot of water, don't heat plastic, use glass and ceramic stainless cookware, no heating plastic, no leaving the water bottle out in the car, gulp, gulp. Can't do it. Those chemicals are causing you pain. Avoid hydrogenated oil. Once again, those trans fats, they're going to make you hurt all day long. Okay, we briefly touched upon some of the causes, a slight touch on the diet. We'll go more into detail next time when we talk about detox and dieting. Thank you very much. Next, we're going to be moving on to the kind of fitness portion of our show. Thank you. Hi, welcome to the fitness portion of our show, and today we're going to be discussing detoxing in a bathtub. So use your imagination, pretend I'm in a bathtub here, with clothes on obviously. However, you're going to get in a bathtub of 104 degrees, and I want you to check that temperature. You're going to get in that bathtub, maybe adding a little bit of mineral salts or bath salts, Epsom salts. You're going to get into that 104 degree bathtub. You're going to wet your towel, and you're like, going in the bathtub with a towel? Yes. Because we're going to try and hold as much heat in as we possibly can. You're going to sit in that bathtub for 10 to 20 minutes, and what I'm going to try and do is I'm going to try and induce you to sweat. Most people don't sweat anymore. And so sweating is one of the best ways to detoxify. Sit in that tub for 10 to 20 minutes. If you start to feel woozy, you get out. I usually drink a little bit of electrolytes to help me when I get woozy like that because I'm perspiring. Detoxification, keep that towel nice and wet, get out, let your body for about 5 minutes perspire, get in the shower and rinse off all those toxins. And if you can do that 2 to 3 days a week, that'll help your body detoxify. The skin is one of the best detoxifying agents. Sweating detoxifies. Next, we're going to be moving on to the research portion of our show. Thank you. You sweat so much, you don't need to do that. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano. Ralph?
And thank you for the intro. Well, the first subject we'll start out with is anxiety. Not that there's any reason for anybody to be anxious these days, considering when bills are due and trying to earn income, and February being the shortest month of the year, so bills are due much earlier than in January. Well, there may be a solution to that that's been around for a long period of time, and you can thank it for your ancestors. It is the herb chamomile. Now, a lot of you heard about that, but this is the first good clinical trial of chamomile. Now to a subject or a publication called Faculty of 1000. Michael van Amergen and Beth Patterson drew attention to the first randomized controlled trial of chamomile for the treatment of general anxiety disorder. This is the conclusion which they came to. They said chamomile extract therapy was found to be efficacious for moderate GAD. So good was this trial, it's being printed in the Journal of Clinical Psychopharmacology. They also said, in addition, suggest that chamomile may have a modest anti-panic activity in patients with moderate GAD or, again, general anxiety disorder. It may potentially be used in those who are averse to traditional pharmacology, which is pretty cool for something which you can buy just about any place. They also said this adds a lot of strength to the use of chamomile because this was a very, very rigorous trial. So yes, chamomile has worked for centuries, and now it's just proving something our parents may have known from a long time in good, double-blind, placebo-controlled studies. So cool. Then for those with H. pylori or Helicobacter pylori and basically infected gastritis, this is being printed in the January 28, 2010 World Journal of Gastroenterology. What they've discovered is that probiotics do help. So much so, they said probiotics provide an alternative method which can inhibit H. pylori infection efficiently without antibiotic-associated side effects. Again, this is the World Journal of Gastroenterology, a very prestigious publication. And they also said, too, unfortunately, the side effects of antibiotics reduce the curative effect, and, of course, people don't want to stay on it for treatment compliance. They found, not really unusual acidophilus, Lactobacillus fermentae, but also, too, just Lactobacillus acidophilus, a very, very, very common, very inexpensive probiotic that's been out. You can find just about any place. So if you get these issues with H. pylori and gastritis, it's definitely worth a shot. They said, quote unquote, too, just to quote the journal, thus lactobacillus can be a choice to replace antibiotics as an adjuvant to antibiotics in treatment of H. pylori infected diseases. The irony about that is those on the antibiotics may not realize that the antibiotics kill the Lactobacillus acidophilus and many other friendly bacteria they recommend. So, not a bad option. If you can, do the Lactobacillus acidophilus first. You may be quite surprised that something can make a huge benefit without it doing any harm. And then we go to another problem in those areas called Crohn's disease. This goes back to vitamin D again. What they discovered is that vitamin D acts to alert certain cells of invading microbes. So what they found in individuals with Crohn's disease is that they usually tend to have very low vitamin D levels. So when infectious agent is consumed, bad food, who knows what it is, something that shouldn't be affecting the body at all, the body can't respond, and these microbes start creating a lot of damage. So this was basically in the latest journal of biological chemistry, and this was printed January 27th. They said too, quote unquote, siblings of patients with Crohn's disease that haven't yet developed the disease might be well advised to make sure their vitamin D sufficient. They also said too, which is quote unquote, this discovery is exciting since it shows how an over-the-counter supplement such as vitamin D could help people defend themselves against Crohn's disease, says Marc J. Savant, professor at the University of Montreal's Faculty of Pharmacy and study collaborator. Says, we have developed a new treatment avenue for people with Crohn's disease or other inflammatory bowel diseases, which is kind of interesting because what you're noticing is a trend is a lot more towards the poison makes a dose mentality, where people normally think in order for something to be effective, it has to have side effects. We're running away from that now, realizing a lot of these very inexpensive supplements can make a tremendous amount of benefit, and they do, compared to what most propaganda has been telling people for years. They are effective and are well studied. So much so, out of the publication of Experimental Biology and Medicine, they developed a formula, and quote the title of it, researchers developed dietary formula that maintains youthful function into old age. What they did with this, and I'll quote it since it's pretty important, the study found that a complex dietary supplement powerfully offsets the key symptoms of aging in old animals by increasing the activity of the cellular furnaces that supply energy or mitochondria and by reducing the emission of these furnaces or free radicals that are thought to be the basic cause of aging itself. Bottom line, it came down to this. In old mice, which they gave this formula, they were acting and operating just as well as the young mice. In the controlled group, which did not get the formula, they demonstrated the exact same age-related decline that you normally find in humans. They reduced their ability to act mobility, activity, overall health by 50%. Zero decline in the older mice taking the formula, 50% decline in the mice without. Unfortunately for the population in the United States, most of you do without. What is this incredibly complex dietary formula? It's such a mystery? Well, I'll read it to you since they were kind enough to actually print it in the article. Ingredients consist of items that were purchased in local stores selling vitamin and health supplements from people, including vitamin B1, vitamin C, vitamin D, vitamin E, salicylic acid, beta-carotene, folic acid, garlic, ginger root, ginkgo biloba, ginseng, green tea extract, magnesium, melatonin, potassium, cod liver oil, and flaxseed oils. Multiple ingredients were combined based on the ability to offset the 5 mechanisms involved in aging. What they simply did, they made it into a liquid formula, soaked it into a bagel, sucked it up, and this way they could properly administer it to the mice. They also said for aging humans, maintaining zestful living into later years and may provide greater social and economic benefits than simply extending years of likely decrepitude. One thing about living a long life, another thing about living a long, healthy life. The study obtained a truly remarkable extension of physical function in old mice, far greater than the respectable extension of longevity that they had previously documented. This holds great promise for extending the quality of life of the health span of humans. So for all those news people that have been knocking vitamins and supplements for a long period of time, this is another good study which you should be reporting on and introducing to the public by keeping them healthy and keeping them free to make decisions that they want to do later on in their later years. Don't just give them the impression that they're just going to go old and there's nothing they can do about it. They can. And then, outside of that, I'm going to move to the magnesium one, since we did a study of magnesium. MIT researchers found out that half the population is deficient in magnesium. Why is that important? Magnesium boosts brain power a lot. They said, quote unquote, magnesium, an essential element, is found in dark green leaf vegetables, fruits, spinach, and those who get less than 400 milligrams daily are at risk for allergies, asthma, heart disease, and other conditions. But the most thing they discovered about magnesium, it had a positive influence on learning and memory. And their quote, half the population of industrialized countries has a magnesium deficit, which increases with age. If normal, even higher levels of magnesium can't be maintained, we may be able to significantly slow age-related loss of cognitive function and perhaps prevent and treat the diseases that affect cognitive function itself. Well, thank you very much.
Excellent information, Ralph. Kind of goes hand in hand with the chronic pain explanation on magnesium. Do your research. We thank you for joining our show, and on to the series on chronic pain next time. Thank you very much.